Sometimes researchers design quantitative studies that are more observational in nature, which means we're not really interested in intervening or manipulating any variables. We just want to collect data as it exists and use that kind of design to answer our research question. And so those kinds of designs are considered to be non-experimental, often other times called observational studies. So this video is going to kind of introduce some common non-experimental designs that are specifically used in nursing research, but are also used in other disciplines as well. So first of all, as I mentioned, if the researchers are not doing any kind of intervention, they're not controlling the independent variable at all, they're only collecting data as it exists for the participants, then that study is non-experimental or observational. Okay, so non-experimental studies are oftentimes not necessarily trying to be cause probing. They're not trying to infer cause and effect relationships between variables. Sometimes they do, but not all research is meant for causal relationships. Sometimes we're just trying to describe something, figure out prevalences of different kinds of conditions, or those types of things. So we don't always want to manipulate an intervention, or sometimes we can't ethically manipulate an intervention. So for example, we, the researcher, cannot manipulate gender. So that variable is not a manipulatable variable for research purposes. Also, smoking, we should not ethically manipulate smoking. So if I'm trying to do a smoking cessation study, I can't pick a group of 50 people and tell them, okay, now all 50 of you have to start smoking 2 packs of non-menthol cigarettes, combustible cigarettes a day. And these other 50 people cannot smoke or consume any kind of tobacco products for a month. And then we're going to bring you back to the clinic and we're going to check some data. That's not ethical to do that. So a lot of times you'll see those kinds of studies, like smoking kinds of studies, are going to be non-experimental. So that is what this video is going to cover. So one kind of popular common non-experimental study design is called a correlational design. And the key word in correlational is relation. So we're looking heavily at relationships between variables. We're trying to see, is there an association or a relationship between the variables in our study? And we test that using different types of statistical analysis. um, Maybe Pearson's product moment correlations, Spearman's correlations, like there's a bunch of different stats tests that can be used. So one interesting thought here, cause probing questions like cause and effect for things, for study designs that we can't manipulate for possible ethical or legal reasons, can also often be addressed using a correlational design. The problem is correlation does not prove causation. That's like I could not do this video and not say that. So there are correlational non-experimental designs that try to infer that one variable caused changes in the next variable. The problem is that a lot of times these non-experimental studies are not able to control for a wide variety of confounding or extraneous variables. So how do we know for sure in the without a lot of control in our study that X caused changes in Y? We can see that X is related to Y, and increases in X may be related to increases in Y and vice versa. But can we automatically infer that X caused changes in Y? So one really wide-standing statistical research maxim is that correlation does not prove causation. So anytime you're reading a correlational study, you should kind of have a little radar looking in their discussion section toward the end of their study where they talk about their conclusions and what was the answer to their research question. Are they throwing around words like cause or affected or things like that? Because if so, we need to be aware, was the study design rigorous enough for us to make that kind of inference? Oftentimes, no. So we have to be careful when we're being a reader or if you're designing a non-experimental study that we're not trying to presume cause and effect when our design is not strong enough to infer cause and effect. So hopefully that soapbox didn't take too long, but you see that so often. Now, there are some studies that are non-experimental that do like modeling. So we use things called path modeling or structural equation modeling, where we actually try to look at which variables are more predictive of different changes in variables. So that sometimes is like a causal design. But anyway, I'm kind of getting off on a tangent here. These are very much weaker than a randomized controlled trial or a true experiment for cause and effect questions. But some of them, depending on how strongly we control things, can support causal conclusions. And you'll see that in just a minute. So there are different types of correlational studies, and often you kind of classify them prospective versus retrospective. So prospective, think about that as looking forward into the future, and retrospective is looking backwards into the past. And that's kind of a good way to think about this. So a prospective correlational study is oftentimes called a cohort study for like medical researchers. And so an example of this is, let's say we're really interested in studying mental health outcomes like depression or anxiety, loneliness, emotional exhaustion, whatever our mental health outcome is, and their connections or association with the experience of miscarriage. So we could actually test this in a prospective correlational study. If I were able to contract with a couple of obstetric groups that were able to give me the contact information of women who had experienced a miscarriage, and I could contact them and let them know that I have a study in place where I am getting a group of miscarriage experiencers together, and we're going to follow them and collect data over a course of 6 months. And what we're trying to show is that there is a relationship between having experienced a miscarriage and the level of depression. Okay, so that kind of study could be studied using this prospective correlational design. Okay, these are very much stronger than a retrospective study. So before I really talk about why, I'm going to skip to the next slide and tell you what a retrospective study is, and then we'll come back to why the prospective is stronger than the retrospective. So here is the retrospective design, and we can use the same example. It's just going to be looking at it backwards. So what we would do for a retrospective correlational design is we have a group of people now in the present who have depression. They have my outcome of interest. So I want to look back at these people who have my known outcome and see which ones have experienced a miscarriage in the past 6 months. Okay, so I'm looking backwards. I start with my calls and I look backwards to see what personal factors could have been related to my outcome. Okay, maybe it's miscarriage, maybe it's previous depression diagnoses, maybe it's loss of a job, loss of a loved one. It could be a host of different things. So oftentimes these are called case control designs in medical research. That's very commonly used, a case control. So lung cancer has been studied this way very often in the past. Really, there's no way to do a full experimental study on smoking causality with lung cancer. So what, because I've said earlier that some variables cannot be ethically manipulated. So I couldn't start with one group and make them start smoking for 20 years and have another group not smoke for 20 years and then check their outcomes to see which ones developed lung cancer and which ones didn't. I don't want to ethically manipulate smoking. I could, however, look retrospectively at a big group of people who have been diagnosed with lung cancer. That's my outcome. And I can look backwards at their past medical history. So, what have they been exposed to? Or what was their smoking or their secondhand smoke exposure? Did they all work in a certain kind of industry? Did they have chemical exposures? Did they have a family history? So that's a case control design where you start with cases that have lung cancer, and then you have a control group that does not have lung cancer, and you look backwards. What did they have in common? What was different between the two groups? And we're trying to show that what is related to a diagnosis of lung cancer, not what caused the lung cancer. That's very important. The terminology matters here. So now I go backwards to prospective to talk about why prospective designs are stronger than retrospective. And it all has to do with the data we're collecting. Retrospective starts at the outcome and looks backward for presumed relationships. What was related to this shared outcome among all these participants? Whereas prospective starts with the presumed independent variable, the miscarriage. Okay, so all of these people in this study all had a miscarriage. Okay, so now we're going to follow them into the future and collect new data on our outcome, which is depression. Okay, so the whole difference here is that I'm collecting new data. I'm not relying on previously collected data like medical records or people recounting past experiences. Okay, I'm collecting new data as it happens. So I'm physically contacting all of these folks and getting them to do new questionnaires on their current level of depression. I'm not looking back over hospital medical records or provider practice medical records from 2 years ago and relying on previously collected data. That is one of the main reasons why prospective designs are stronger. Okay? But again, neither of these designs are as strong as experimental designs because no matter how well we control for things in this kind of study, there's no heavy control. We're not introducing or manipulating anything. We're just relying on, as it happens, observational facts. Sometimes, as I mentioned earlier, we're not really interested in cause and effect at all. Perhaps there's a new phenomenon that we really don't know a whole lot about. And so we just want to describe that phenomenon. Let's take, for example, workplace violence. So there are different types of workplace violence. In hospitals or for nurses, that looks different. So is it a patient who is committing the violence against the nurse? Is it an outside visitor, such as a family member who is committing the violence, or is it coworkers? So there's a bunch of different kinds of or types of workplace violence. And I'm not trying to get into all of that. But what if we wanted to just do a descriptive study that looked at the prevalence? Like, how prevalent are those types of workplace violence for nurses? Is the prevalence growing? Is the prevalence of workplace violence more likely now? Is it more prevalent now than it was in the past decade? So those are kinds of questions that could be answered using just a descriptive study design. Okay. And then sometimes we marry those two terms together. So it's a descriptive correlational study where we're collecting kind of prevalence or frequency like descriptive statistics, but we also want to see what variables are related within our study. So those are also a common design in medical nursing research. So there are advantages and disadvantages to this kind of non-experimental design. First of all, advantage, they're easier. Okay, you can collect efficiently a large volume of data without having to do an intervention of any kind. So oftentimes they're cheaper. You don't maybe even need to get a grant to do this kind of study. And with the use of internet data collection using questionnaires like Qualtrics or SurveyMonkey or something like that, you can collect large, diverse samples and get large volumes of data very quickly. And maybe not even talk to participants because we're not introducing an intervention. So we don't even have to physically see them. We can just send them a survey link via email or post it on some kind of website and get loads of data that way. So that is definitely an advantage. But the disadvantage, as I've mentioned multiple times, is correlation does not prove causation. So we really have to be careful with the conclusions that we're drawing from non-experimentally designed studies. We can say, depending on what our statistical analysis looks like, that intervention A is related to intervention B. If A increases, maybe B decreases or increases, but we know what that relationship looks like with some level of certainty. So that's about the main conclusion that we can draw from this kind of study. Um, so again, you just have to be careful with those causal inferences because those are really not necessarily need to be done in this kind of study. Those are more geared toward experimental studies when experimentation is able to be done. When it's not, then sometimes we can use some of these non-experimental studies, specifically a cohort prospective study, to kind of make some cause and effect inferences. So hopefully this has clarified maybe some misconceptions you've had about non-experimental research. And again, my videos are very focused on nursing research. So in other disciplines or social sciences or medicine, these same tenets may not hold true because I'm a nurse researcher. So I'm teaching this from the frame of reference of a nurse researcher who pretty much reads nursing research. So anyway, thanks for listening.